Communications. I'm Susan Claiborne with Caroline Canistrari, and November is Lung Cancer Awareness Month, a time to highlight the importance of early detection. Joining us is Leslie Wallace, Director of Imaging Services, and Dr. Fry with Radiology of Huntsville to talk about who should consider a lung screening and how it can save lives. Thank you both for being here. And Leslie, we're just going to kind of start with you and jump right into lung screening, awareness, cancer month, all those things long during November. So just kind of tell us kind of what is a lung screening and how does it help detect symptoms or problems?
A lung screening involves a computed tomography scan, which is better known as CT scan. It is quick, it's painless, it uses very detailed images, and the term low dose associated with it just refers to the fact that it's less radiation than a standard CT scan would be.
Okay. I didn't even know that there were different doses when you did a CT.
I didn't either.
Yeah,
I learn something every day.
Yeah. So why is such early detection so critical when it comes to lung cancer or other kind of lung diseases?
Well, we know that in order to treat any cancer, for that matter, the earlier detected is better. And we know with colon cancer or breast cancer, screening programs pick up these cancers at a very early stage where we can do something about it. With lung cancer, the best way to treat lung cancer is prevent it from happening. I would be remiss not to take this opportunity to encourage anyone that is smoking to stop smoking. Smoking is the cause of lung cancer primarily, and it is still the number one cause of cancer death in the United States. So if you have a past history of smoking, or if you continue to smoke, the next best thing is to catch it very early, and that's where the screening CT comes in. I think the current recommendations is from the beginning at age 30 through 50 to have it done once a year. We'll look at it, look for a very small nodule, and based on its appearance and its size, we'll either direct them to further imaging to a surgeon or come back in 6 months to 1 year interval follow-ups.
Well, we hear that so many people have different little spots in their lungs. I know, even me or a family member who've had them done, they say there's things that show up from where you've had pneumonia or COVID or kind of things like that. But with a CT, you can kind of tell the difference. I guess those spots look different for...
Well, unfortunately, with lung cancer, there's a lot of overlap. So when we look at nodules, when we look at the size, we want to look at something over 2 or 3 millimeters. Then that nodule may have a different appearance. Take the morphology and the size all together, and we come up with recommendations on what we should do for the patient. Usually it's a follow-up to see if there's a change. It's very important. Just because it changed does not mean it's cancer, but at that point we need to prove whether it's cancer or not.
Yeah, and I asked that because I know I have one little small spot that, we do every year with my normal CT kind of thing just to see like if it's changed or size. And it, I guess, has been there for a while now and it continues to stay, but we continue to watch it. So I guess that's part of that.
So a lot of people may feel nervous about imaging procedures in general. So can y'all walk us through what a low-dose CT lung screening would be like, the experience, and what patients can expect during their visit?
Well, there are no needles, no dyes, no injections involved. You can eat, you can drink, you can take your regular medications. It's about a 5-minute scan from the time that you lay down on the imaging table. Typically, once you come in, you're asked to put on a gown just to remove any artifacts from your clothing, and the whole total procedure is about 5 minutes, and it's completely painless.
Doesn't sound too bad. So how do you and your team work to make the experience comfortable and reassuring for patients who may experience that anxiety?
Well, just reassuring them that the yearly visit is the best thing that they can do. Some people are just anxious about having a CT scan anyway. Some people's anxiety is the exam itself, and some people's is the results. So, the technologist that's interviewing the patient kind of gets a feel and tries to reassure them, Obviously it's a 5-minute exam. We do things for comfort. We put a washcloth over your eyes. We prop your knees up and try to make you as comfortable as possible. But then again, for those that are more concerned about the outcome of the scan, the best thing that we can do is to convince them that they are doing the best thing for their health by having this done.
Yeah, anxiety is real when it comes to getting those screenings. I know my mother is very nervous and confused after kind of one bad experience with a pet. It's like now everything she thinks is the pet. And I know, the CT structure is very different than an MRI, very different than a pet. And so she's always concerned, is this going to be the one where they send me all the way through the tube? Or, we have to deal with those anxieties a lot. And I know a lot of people do and get very confused about that. So Athens-Limestone Hospital has invested a lot into imaging technology over the past few years. So can you share with us some of those tools that improve accuracy or help with early detection?
Well, at Athens-Limestone Hospital, we're as advanced as any major medical system. And being part of the Huntsville system, if there's anything we don't provide, we provide there. But as far as the low-dose CT, we're on the cutting edge. We do the same procedure, have the same radiologists that read it, the same protocol as they do over at Huntsville Hospital. And so it's very important that we detect this, like I mentioned before, as small as possible. Before, it was just a chest x-ray. And it was very difficult to see a pulmonary nodule. And by that time, usually it's too late. So we want to catch it early. So to use the low-dose CT, of which Athens has, we could detect it at a much earlier time and hopefully end it with better results.
And so kind of tell us again, what are the guidelines on who should receive a lung cancer screening?
Well, the guidelines by the American College of Radiology and American Cancer Society is either smokers or former smokers aged 50 to 80 who have greater than a 20-pack-year history of smoking. And that means if they smoke a pack of cigarettes a day for a year, that's 1 pack year. So they've smoked for 20 years, or they smoke 2 packs of cigarettes, they would be smoking for 10 years. And they would get the recommendation by their referring physician, who will then schedule them at Athens-Limestone to have the exam.
Okay. Is lung cancer screenings covered by insurance?
That again varies from insurance to insurance, but most those that qualify and meet the guidelines qualify for insurance coverage.
Okay.
So beyond screening, what are some lifestyle choices or preventative measures that people can take to protect their lung health? And we know no smoking. People have got to stop smoking. What other measures can people take to protect that lung health?
Well, number one, smoking. I'll say again and again and again. Don't smoke, and if you're not smoking, don't pick it back up again. But secondhand smoke's a very strong cause of lung cancer too. So somebody in your family, if you grew up with, there's always a risk of cancer that way. The alternatives like the vaping and chewing tobacco has their own risks that are just as important as the lung cancer. So tobacco products, please stay away from.
So important. So how important is it for individuals, especially those with the history of smoking, to have those open conversations with their healthcare providers about screening?
Yes, the providers, they know the recommendations, and it's very important if they don't bring it up for a patient to bring it up. If you're concerned about picking up lung cancer soon, if you're a former smoker or current smoker, then you need to ask, and then they know what to do as far as scheduling an exam at Athens-Limestone.
Do you see a correlation? Is it typically lung cancer caused by smoking, or is there sometimes a genetic predisposition to lung cancer?
There are certain lung cancers that are genetic, but the number one cause is smoking. And so the rest, there's not really a test to pick it up. It would be, if you have a cough, then it would not be a low-dose CT, it would be a regular CT of the chest. So other reasons to look for lung cancer, but as far as screening goes, it's for people that smoke primarily.
Yeah. And so November is obviously a great month to kind of bring awareness to that, kind of like how we do mammograms in October. Let's get our lung screens in November, especially for those smokers. And I'm sure that smokers are probably less likely to follow that because they don't want to, they're scared or concerned about finding that out. So kind of in closing, what message would you like to leave for our community about the importance of taking charge of their health through preventive screenings, whether it's lung cancer screening, mammograms, or any? Because obviously in your profession, we rely a lot on the technology of imaging services to find things. So
I think that all cancers, they usually develop silently and slowly with no signs and symptoms, and that's why it's always easy to put off those screening exams. But having your screenings when you qualify or you meet the criteria, it empowers you and it gives you the best chance for a long, healthy life. So I think that, it's just the realization of that you qualify or you have habits that should encourage you to have your annual screenings.
I agree. Well, thank y'all so much for being here and sharing that information. Thank you both for sharing your expertise and for your team's work in helping detect disease early. To our listeners, screening saves lives. If you have a loved one that meets the criteria for a lung screening, talk with them, talk with your healthcare provider, and keep having those healthy conversations.